Hey guys, so in this video I'm going to talk about the avascular necrosis. So avascular necrosis happen mostly in the bones that have retrograde blood supply. So in previous video we have seen what are the bones that have retrograde blood supply and that I have included in the basics of hip. Let me see. Yes, so retrograde blood supply is in the hips, scaphoid, talus and patella. So these are actually the bone which have this retrograde blood supply, and that's why they are prone to the avascular necrosis, because blood supply can interrupt and ischemia will lead to the necrosis of the bone, and mostly it is traumatic because fracture can lead to all of these conditions. So let's see what is this condition actually. Avascular necrosis, it can be traumatic or it can be idiopathic. So let's first learn about the femoral head. What are the idiopathic conditions that can lead to this? I mean, not the idiopathic but non-traumatic. Steroids, alcohol, then Gaucher disease, sickle cell anemia, Casson's disease, that is radiation also. So these are the causes which can lead to avascular necrosis of the femur, head of the femur, along with the traumatic cause due to fracture of neck of femur. And the classification we are using is the Ficat and Ehrlich staging. So let's see what this is about. So this is Ficat and Ehrlich staging. Stage 1, Stage 1 is totally normal. X-ray or MRI or scintigraphy, so everything will be normal. Stage 2 have A and B. So in A, due to avascular necrosis, there will be cystic lesion, means osteoporosis, due to osteoporosis and sclerosis also. And in B, there will be subchondral cystic lucency, and that is crescent sign. Now the third one, so we have to remember this one, that stage 2B have this crescent sign. Stage 3, when the femoral head collapse will happen. So irregular femoral contour will be there. And in stage 4, there will be total femoral head collapse and all other complications like acetabular involvement, articular destruction. So osteoarthritis feature will be there, like narrowing of the joint space, osteophyte formation, subchondral cyst formation, degeneration, so degenerative joint disease. So osteoarthritis, acetabular involvement. So we have to remember this stage 2B is crescent. Stage 2B is actually crescent, and stage 3 when the collapse happen, and stage 4 when osteoarthritis will happen. Now, investigation of choice is MRI. Now there are other fractures like scaphoid, in which proximal pole will go to necrosis due to fracture of waist. So in scaphoid there is proximal pole, distal pole and waist. So in waist fracture, this blood supply is like this. So blood supply will hamper and proximal pole will go to avascular necrosis. Now in humeral head avascular necrosis, it is same like femoral head. So in which, but you can see the snow cap sign, but talus has different, in which the body will go to avascular necrosis. So here is the head, here is the neck and here is the body, and blood supply will be like this. So fracture of neck will give rise to the body avascular necrosis. So this was about the avascular necrosis of various bones which are getting retrograde blood supply.